Welcome to Coffee with Samso in 2021, our very first one for the year. I've got Thomas Hanley here with Singular Health Group, which is doing its IPO as we speak. So it's a very, very interesting topic on 3D imaging, medical 3D imaging. Thomas, over to you, and let's hear the story.
Thank you, Noel. Singular Health the project started about 3 years ago when a prominent gynecological oncologist had a very particularly difficult case of ovarian cancer to deal with. They then went and he tried to view the cancer in those traditional two-dimensional images, and found that he was really wanting something in 3 dimensions and virtuality to assist him prior to operational surgery. So he came along, brought on a couple of software developers, and the first iteration of MedVR was born. So the MedVR software, as part of Singular Health, is essentially a software application that converts those CT, MRI and PET scans into 3D and virtuality, and then enables the user to put on a headset and literally walk inside the human body and look at the immersive elements and the adjoining areas of the body that are affected by that particular pathology.
I mean, virtual reality or augmented reality, this kind of stuff, that what you're talking about, the 3D imaging,
yeah,
it's not new in obviously in the world.
No.
But I think it's the first I've heard, but then again, I'm not in the medical field, so I can't speak for everything. But can you just give us a rundown? Where is this technology, where is this concept at in terms of technology progress in that area?
Sure. In fact, we've been quite fortunate. So a couple of our competitors in the United States started about 15 years ago, and at that point in time, the hardware was really not at a point where you could utilize this technology on an everyday basis. And it's really been the gaming side of VR and the increased ability of graphics cards with NVIDIA that's brought this technology into the retail environment and enabled us to come in with a very low price point to work in the whole VR and augmented reality space. So in our case, we work with data points, so it's millions and millions of data points that we then combine from hundreds of different slices of MRI and CT in a perfectly accurate representation of that human body, and enables you to, as in all VR experiences, walk inside and have that full immersive experience. So it is unique to us because we've been able to utilize the technologies that are now available in mobile phones, on iPads and VR, and put our technology across all those different modalities, and that's something that at the moment no one else has done.
So in terms of a investor's point of view, obviously
yep,
the big question is, okay, fantastic, best thing since sliced bread,
exactly.
But in your words, right? So
Yeah.
that guy can be saying, hey, you know, where are you? Are you the first guy that's done it? Are you the second? Are you the fifth?
Yeah, we're the first that have been able to render those images on the actual device, as opposed to rendering them in the cloud and waiting for a prolonged period of time for that image to come back again. It's now being utilised by surgeons, it's been utilised by dentists and by universities for education purposes. So this is a technology that, instead of spending tens or hundreds of thousands in order to implement inside a hospital or inside a school or a university, it's less than $5,000 in terms of the hardware costs, and that's very unique in terms of its implementation. Makes us, I think, leaders in this particular field.
Going forward, I guess, in terms of your what you guys are offering, where is your target? Where's your target customers? Is it doctors, specialists, schools?
Yeah, well, utilising the platform. So back in traditional days, you would have received a CT scan that looked something like this,
Yeah.
and only a doctor or a radiologist could sit down and work it out. And then those doctors would have to ferment those 2D images into a 3D image in their head to understand or better appreciate what they're going to encounter when they go inside the body. What that meant is, of course, it's left out education, it's left out patients like anyone who's ever received a CT scan from being able to view these files in a way that they understand. So from a market point of view, as I said before, we already have people that are using this in a surgical environment. we have a version of our 3DICOM viewer, which is our 3D only application, that's available online. You can download it for free, and at the moment, of the hundreds and hundreds of downloads that we've had, over 70% of them have been patients who are looking for ways to see these images that in a way they understand. And so when you realise there are 6 million scans, CT, MRI, PET scans that happen in Australia, hundreds of millions of scans that happen globally, there's this enormous market for people to understand what's going inside their body, right? And also for people to learn and become educated, whether that's a student at a ATAR year 11, 12 level, or a medical student, both in school and remotely. These sort of images are now becoming more and more usable in that space.
Like all these doctors or people in the medical field, they have signatures and handwriting that we cannot decipher.
I do too, but yeah.
Yeah, so I'm thinking, okay, you got your CT scans and all this kind of stuff, and like you said, it's the guy who's sitting there that's interpreting it and say, oh, you've got this or this or this.
Yeah.
So is it fair? Correct me if I'm wrong. Do you understand that what you guys are about is you're going to be interfacing between that high level and the likes of myself who goes and does the scan and being able to visualize and understand that?
Yeah, certainly. So whether that's so with our TGA approval at the moment, we have TGA approval for this. Surgeons can use this as a visualization tool. They can use it to perform surgery or to plan their surgery. So we have videos on YouTube of surgeons planning their surgery using our technology at the moment. But the big part of the market, as you said before, is that interface where those surgeons, those doctors, those clinicians can sit down with patients and show them what's going on inside their own body and make them understand. And I can take that from my own experience personally. I mean, this time last year, last December, December 2019, I was diagnosed with a tumour, cancer on my kidney. And these are my scans that I was showing you before, and all I could see was these sort of two-dimensional slices, and I'm just looking at going, what does this mean? So I then got the DICOM file, put it onto VR, and sat down with my oncologist, and he showed me exactly what my condition was, what it was affecting, and what the progress was going to be in terms of surgical approach and the sort of long-term recovery that I would have. It made me feel a lot less anxious. But more importantly, it showed immediately the effect that VR and 3D has in terms of bridging that knowledge gap between what you see here and what you're able to see. And that now enables us to put things on the mobile phone, so you can see your VR, your scan in 3D on your mobile phone and rendered on your mobile phone. And that's completely unique to our technology. Previously, when you'd go to a SHG or a PRC, you'd get an app, and that app would be in 2 dimensions. So you'd be looking at your image slice by slice by slice and going, it means nothing to me. Now that's completely different, and we lead the way in that.
In terms of the smarts, is the smarts, I mean, obviously, when I was reading about what you guys are doing, it's sort of synonymous to what the mining industry, my exploration industry was, when we used to have just 2D maps of sections. Sure. And then depending on how many glasses of wine you've had, your model starts to become reality. Yeah. And then 3D software came in, but then it was only for the desktop, and you had to be in the office, and the guy in the field would just get images and still not be able to do it. And then suddenly technology went to a point where the exploration geologists in the field could actually see things 3D, where he's drilled, etc., etc.
Yeah.
Are we seeing that kind of progress with what you guys?
Yeah. So we've been building this application over the last 2.5 years, and it is it's an application that is commercialized. So it is I guess on that sort of par where you're now seeing that sort of evolution from the 2-dimensional to the 3-dimensional. But in addition to that, and I'll come back to the geospace in a moment, in addition to that, what we're now able to do is add artificial intelligence and machine learning algorithms to those images. So we're doing a project with CSIRO where they're able to take that image that we get of, say, a spinal column. We see it in 2-dimensional slices. All of a sudden you see it in VR, but now the AI tools will go through and segment every single individual vertebrae. right? And so then you'll be able to go into the image, pick a vertebrae, look at it in 3 dimensions in VR, and then send it to a 3D printer. And we're building the first ISO 13485 3D printing facility in WA for medical implants and surgical guides. We're using titanium. So those elements of machine learning that come onto the additional VR, the 3D images, are an important next step in understanding. The other one that we're working on quite closely is early stage lung cancer diagnosis. So being able to look at an image in 3D, and then the system goes through and tries to work out where that person has a risk of early stage lung cancer. So it's not just that movement from 2D to 3D, but all of a sudden, once you have that visualization, to be able to add those tools in there that give you that much more information about what's going inside is just a light year leap ahead of where the market is at the moment. Moving on
just before I lose thought.
Yep.
I'm getting old.
That's okay. So am I.
How smart is the smarts in terms of, like, you're saying, okay, you can dissect down to the segment of vertebrae. Mm-hmm. How smart is that saying that? I'm assuming vertebrae are not, everyone's vertebrae is different.
Exactly, that's right.
So how smart is it smart to say that guy's vertebrae is that, or is that a kind of information in or rubbish in, rubbish out?
Look, that's a very good question. So for these machine algorithms to learn, you need data sets, right? So in the case of working with things like early stage lung cancer, when you have, say, 300 data sets, you get to a certain level of accuracy. You need thousands of data sets for the algorithm to then detect, to say someone has scoliosis. So you and I seem to have fairly straight vertebrae. The system will likely, within a certain level of accuracy, pick out each individual vertebrae and create individual files. Then someone with scoliosis comes along and sort of looks a bit like that. The system has to have a number of those data sets fed into it, into the algorithm, for it to learn to map whatever the vertebrae looks like. So it's I guess with these sort of things, it gets smarter and smarter with the more data you add to it. And that's really where our specialty comes in, managing those large volumes of data that come into the medical space, or as in the fact the geospace. We've been working with block models in the geospace that have millions of data points that enable us then to improve the algorithms that we're using, and have worked that back into our medical space so that we're now 400% more efficient in terms of uploading and manipulating these images in the VR 3D space in the medical side. So it's all sort of connected in that way.
Okay. I suppose moving on from the technology and things like that, on the commercialization.
Yep.
What's the sort of steps I've been seeing on your prospectus that you've got in the industry, you've got those players, and it's a big market. It's multiples of billions kind of market. Where do you guys see you moving along that path, or how, I should say?
Well, I guess. I mean, most of what we do inside, most of the funds raised inside the prospectus are targeted towards ramping up our sales and marketing efforts. So across the 3 medical platforms that we have, so we've got the MedVR viewer, which is the virtual reality viewer. We have the 3DICOM viewer, which is a online marketing effort. So there'll be apps that will be on the Apple, the Android, Windows and iOS, and you'll be able to download those apps, and depending on the level of functionality you have will depend on how much you get charged. And so it's either free, $5 a month, or $30 a month to use the surgical version of the 3DICOM viewer. So most of that expense is going into that sort of sales and marketing effort, and where the MedVR, because of the additional hardware, is a direct marketing approach, which is a slower, longer lead time into sales. The online marketing of the 3DICOM viewer is something that happens really, really quick. Right? It's multilingual, and it is already getting quite significant traction. If you look up 3D DICOM viewer on Google, we're number 1. Okay. So it's that I guess that sort of moves that process along. In terms of the research and development that we continue to do as a result of the prospectus, more of that money we spent on building these new algorithms. So where that algorithm detects lung cancer or helps you segment bone, or determines the best surgical approach for removing a brain tumour. These are the areas of AI and machine learning algorithms we'll be building into these applications over the next 1 to 2 years. In addition to that, as I mentioned before, we have TGA approval, Class 1, which means it's approved medically as a visualization and surgical planning tool. Class 2 means it moves into the diagnostic space, and we're applying for Class 2 in March. And then once we have Class 2, we'll then go to FDA approval using the 510K method. So by 18 months from listing, we hope to have both TGA Class 2 and FDA approval for the application, which puts us really into a very global marketplace.
When I listen to you guys, when you sort of talking about what you guys do, the thing that's ringing in my head is the educational side of things.
Yeah.
Is it correct in my assumption that I think in my thoughts that this could be actually a big sort of market for your application, in terms of, like you're saying, the expert guy sitting in his office, transferring that information down. Is that something that you're looking at?
Yeah, so our patent covers both the volume rendering platform and a collaborative tool. And so we've used that collaborative tool to build an application called Virtual Anatomy. And Virtual Anatomy is our direct education market approach. So that combines simulated 3D color body parts of the body in conjunction with our scans of different pathologies to provide a very comprehensive education platform. And that we're marking that into everything from year 11 and 12 ATAR human biology all the way up into anatomy and medical and radiological studies right through university. So the ability for us to have that application, to have those quality of scans, to be able to use 3D and VR, right, as an immersive approach, is an educational experience that students are not getting at the moment. And then as these medical students graduate and they go into becoming registrars at different hospitals, being able to use VR to look at different scans gives them a better appreciation of what they're about to see when they open up the patient for surgery. So yes, education is quite a significant part of the picture, and it's something that has continued to evolve as we've evolved the technology. So the more we get in terms of simulation of 3D and VR in terms of additional scans, the more educational the system has become.
And in terms of, obviously, the next big question that all investors look at this sector talk about is obviously, are you going to turn up to be one of those cash burn technology firm? And so how do you answer that?
Well, we have a very, very, I guess most MDs or CEOs say they've got a fairly strict discipline when it comes to expenditure. We have a very strict discipline when it comes, so I'll say the same thing and then I'll validate that. We've spent about $2.5 million building our platform prior to the IPO. In the research and development phases that we continue to do with AI, it is being matched up to sometimes 90% by government grants and funding. So we are continuously looking at ways of leveraging the funding mechanisms that are in the marketplace at the moment. And that's not just in Australia. In Singapore, we're looking at building a virtual colonoscopy tool. And we've made an application to the Singapore government for funding to assist about 75% funding of that particular tool. So it's about being clever. It's about knowing that we've got products that are ready to market now. We can generate revenue over the next 2, 3, 4, 12 months. And that the expenditure that we are doing in adding function and value to those are being offset as much as possible by government grants. We have all our software developers are internal. We don't have a whole room of developers in India or the Philippines. We looked at that, but what we realised is that we get a lot better value for money working with developers in Perth. They're harder to find. It takes about 2 months to find a good developer and then train. But it's been a very successful model because we can make those changes and we can get those apps developed and those functions developed a lot quicker in consultation with the doctors and the clinicians who come into our office and sit down with our developers and work out the best, the next tool that we need to build. So that's the way that we see it working. That's the way we see minimising the cash burn focusing on revenue, focusing on offsetting R&D expenditure with government grants and funding.
Is there a sector you're focusing on? Because obviously I see that it's all developed out of, you have ongoing revenue or existing revenue, I should say, in sort of the Asia sector, the Asian sector. Is that something that you're going to grow from or focus on? Or?
Yeah, so a lot of medtech companies focus on the United States, say a particular market. The US is a very, very difficult market to approach. What we've found is that the Asia Pacific region, so these are countries like Singapore, Brunei, even the Middle East, are really, really important sectors to us for 2 or 3 reasons. The first is they're a lot quicker to respond to new technology. Secondly, the competitors that we do have focused their efforts almost entirely in the United States. And so going into the US to compete directly with them is pointless when you have billions of people that are in this particular space. It is a bit of a lot of MDs talk about that whole process of working in Asia, but we really do work in Asia. We have offices, we have joint ventures in Singapore, we have resellers in other parts of Asia. We're looking, believe it or not, into the Chinese market as well, because we see China as an important market moving forward. They have hundreds of millions of scans every year. And technology is very good. So the ability to utilize our software in a big market like China is actually quite promising. The smaller dental practices in Thailand, Malaysia, those sort of areas are also key markets for us. So it's those sort of areas that we really feel a strong market potential for, and we'll be focusing on. Unfortunately, with COVID, we have to do this now mostly online and appoint people remotely. But we hope over the next 12 months that will change.
I mean, with COVID, do you see that as a plus? Because when I was reading about what you guys do, it almost is COVID friendly or future adopted COVID friendly.
Yeah, that's a good point. So telemedicine has been one of the big, or telehealth has been one of the sort of big things that have come out of COVID. And with our collaboration tool, whether it's in 3D or VR, you can have a doctor or surgeon in Karratha collaborating with a surgeon in Paris, New York, Perth, without and looking and manipulating that same three-dimensional image, creating surgical notes, doing measurements, all and being recorded for future use, all as part. And so you get to that point where that telemedicine, telehealth approach has been something that has come out of COVID. And it's something that our software will lend itself to quite nicely. Same with the education. So when you look at our education tool, if you have a teacher sitting in their house and you have 200 students, in all parts of the country, you click onto the app, and as you're manipulating those images on screen, the students see what you're doing. You can hand over that image to another student. As they use it, manipulate it, change it, zoom into it, everyone else is seeing what they're seeing. So again, hardware technology has really helped. The timing has been really good in that inflection point between software and hardware. If we'd had COVID 5 years ago, I don't think the hardware would have really been up to the scratch, as well as the sort of network and NBN speeds that we need to make that happen. So, yeah, COVID I think has been positive in our development.
Yeah, I've always said COVID one thing it has done, apart from all the catastrophes it's created, is that it's forced us to adopt technology and look at that, because we've had this technology telling us to do stuff for 20 years and we said, no. But now it's like, there's no choice. And suddenly you go, oh look, this thing actually works.
That's right.
Yeah.
Last year, the year before, if I wanted to talk to someone in Singapore, you'd hop on a flight and you'd fly to Singapore, right? And you'd sit down and talk to 3 or 4 people and you'd have some meetings and enjoy some chili crab, and then you'd hop on a flight and come home. Now, and you'd never think about, doing a Zoom call with a group of guys in Singapore or London. You'd go there and interact with them personally. So yes, so the fact that we now have things like Zoom and Google Hangouts and Google Meets and Microsoft Teams and stuff, sitting in the background all that time, they've come into their own.
Yeah.
And we've been able to utilise that quite successfully.
Yeah. I mean, 3D imaging, when I thought it was a bit of a mouthful, but when I started understanding where it is, being really virtual reality, just visual, and as we always say, a diagram speaks 1,000 words. I think it's really unique, and it's going forward. That is what we're all looking for anyway.
Yeah.
This is not for driving drones or playing games. Look, at this point in time, I like to, I would let likes of yourself, sell your soul to the investor, with your IPO, and hopefully the ASX doesn't come down on you. But look, guys, it's a good story. I like it. I like the concept. I like the different aspects of looking at stuff.
Yeah.
But Thomas, 2 minutes, sell your soul.
So, all right. Thank you very much, Noel. So, Singular Health, we have an incredible team of young developers, a number of different surgeons and medical professionals that assist us in the development of our technology. Our technology is world leading in that we can render images on multiple devices. We have an incredibly strong board of directors and a very tightly held register. So we see ourselves coming onto this market already commercial, already ready to become commercial. So it's not a matter of developing software. We've got the software developed, the platform has been invented. Coming into this market and only growing stronger and stronger and stronger. So I don't know what to say. I find it sometimes difficult to sell myself, but because you talk so much about the technology, and the technology becomes this sort of almost catch cry for what you do, but you realise at the end, it's not so much about the technology, but it's about people, right? And it's about making sure that the people that we work with are the best that we can and get the best out of them. But more importantly, that the people that use this technology get a better understanding of where they are and what's happening inside their body, and getting a better understanding and a better health outcome. And if our system leads to more and more people having better health outcomes, then we have succeeded, and we have succeeded well.
Yeah, what I really like about it, once I started reading the idea and looking at your industry and your business, but there's a few things that sort of click. Management looks good.
Yeah.
As much as I know you guys, it looks like credentials look good. I mean, you're in the right area. You've all worked in the South-Pacific, the Asian Pacific, ASEAN kind of sector.
Yeah.
I do definitely agree with the fact that they're very early adopters to technology. Medical is a big part of Asian society, and the fact that it's something new, and I like the fact that you mentioned it's a tight register.
Yeah.
That's always a good thing, and I think going forward, the new world, I call it the new world. I think it's really about this kind of technology use.
That's right. Yeah.
We can't go back to where we used to do things.
No.
As you said, Zoom. Today you can say, look, let's have a Zoom call. No problem. Maybe 12 months ago or
18 months ago, you would
go, that's a bit rude.
Yeah, that's right. Well, that's a very, very good point, because I've always sort of grown up with the understanding that when you're working in ASEAN countries in particular, it's about building face-to-face relationships, about being there and building that trust between parties. And so that's why I've spent a lot of time in Singapore and Malaysia and Thailand, because it's about building those sort of, and so Zoom has really sort of made us really sort of rethink how we build those trust and relationships with our team over and our users over in different countries in ASEAN. So it's been a challenge, but I think it's been a really good challenge. Yeah. All
right, that's good. Well, look, guys, you guys feel free to send us messages, and I've been getting a few, which is good. Thank you very much for that, and I'm sure Thomas would be happy to field some questions in his very busy schedule talking to brokers and raising money. And look, I want to thank Mill Point Cafe for letting us have the place. And as usual, I hope you guys enjoyed the sharing that Thomas had. And if you've got the opportunity, subscribe to us and click that bell, as everybody on YouTube seems to say. And I'm going, hey, let's join the crowd. But look, really, when I looked at what you guys are doing, I think it's something different, which is what I like about sharing with people. It's just things that people don't hear of, and then suddenly they see the stock rate through the roof and they go, oh geez, what happened there?
Yeah.
You know, so look, Tom, thank you for giving us the opportunity.
Thank you, Noel. Thank you for your time.
And I hope that we can continue the journey, and maybe when you guys raise and you're at, a billion market cap, you don't go Samso who.
Never.
All right, thank
No matter
you.
what it is. Thank you very much.
Okay.
Thanks.